And here we go. Welcome, everybody, to The Big Idea. I am your host, Dr. Jeffrey Hanna, where we talk about the big idea. What is the big idea? It's how a little vertebra, where your head meets the upper part of your spine, affects your health, your well-being, and can possibly change your life in ways that you may never think is actually associated with that part of your body. And this is a video that I'm doing because I've had two people within the span of just the last weekend asking about how it is that the alignment of the upper neck can help with scoliosis, so lateral curves of the spine. Now, I should preface this that I actually have a pet hate against the use of the word scoliosis, and it's because, based on what we know from psychology experiments, is that if people, specifically adolescents, kids, are told that they have a scoliosis, the first picture that comes to the mind is that of hunchback. And unfortunately then, we find that as these people go into adulthood, they have generally poor senses of self-image, body perception, and also self-esteem. So it's not a word that I throw around lightly at all. I'm very much of the opinion before you even start using that word, you better have a lateral curve of at least 20 degrees. Nevertheless, lateral curves of the spine, these are very common phenomena, and they can lead to a number of aches, pains, and other issues in the body if left uncorrected. And so what I want to do is take a little bit of time to show you what we're finding in the research here, but also what that upper neck connection is and how that might be one of the missing links to be able to help people so that they're able to continue to do the things well into adulthood that they want to do without risk of organ compromise, without the same kinds of aches and pains that are oftentimes associated with it. So let's get into it. We're going to start out first with the story so I can show you what actually happens to create these different kinds of issues. So we go through life experiencing any number of physical slips, falls, trips, sporting accidents, car accidents, little things where there's not necessarily broken bones or even bleeding. In fact, injuries can even happen at the time of birth. If we are breech delivery, forceps, prolonged labor, any number of different combinations right there. And just because we don't have massive amounts of damage to the point where we can diagnose huge amounts of pathology, you can still have subtle little shifts. And even if it is only off by a couple of millimeters, if that shift persists, particularly if it's in the upper part of the neck, what it does then is it produces a bit of a shift through your entire body structure and your neurology. And so what we very often see then is where the head starts to tip a little bit like this and where it starts to turn a little bit like that as well. And that turn in particular is going to be very, very important as we're going to be having this discussion here a little bit just on the development of scoliosis. So what I'm showing here is a little issue at the basically base of the head right up through here that can create tension in your muscles, ligaments, and your nervous system. And your nervous system is your electrical conduit that transmits all the messages from your brain to your body, body back to brain, essential for normal life function. Now, if you've got a problem there, your brain's not stupid, and it's going to try to find intelligent ways to be able to compensate for this kind of stress. And so one of the common ways that we oftentimes will see it manifest is if you've got tension on the brainstem, yes, you can have any number of these different, neurologically based kinds of symptoms. But what your body characteristically does first is it tries to disperse that force throughout the entirety of your body. And we see that show up in changes in a person's posture. And this is why I often say posture has nothing to do with being lazy. It's a reflection. It's an outer reflection of the inner reality. So we see characteristically that one shoulder starts to elevate, one hip starts to elevate. We see it manifest where it starts to create pulling all the way down into the hamstrings, into the calf. Oftentimes a person will get the illusion that one of their legs looks crooked when in reality they're probably going to be about the same length. And a caveat here is that as strong and resilient as your body is, These muscles can only absorb that stress for so long because they're not designed that way before eventually that stress starts to go into the joints and then ultimately into the nerves, which is going to affect any number of different functions in your body. So in this way, this very small kind of issue, when you compound that over months, years, and decades, can lead to physical wear and tear of the joints, can lead to aches, can lead to pains, but as we're also showing even right here, right off the bat, can lead to the development of these types of changes in the posture of the spine itself. And so what the big idea is, and what we do here at Clear Chiropractic, is by focusing on the alignment, the motion, and this is an important word, the stability of those upper joints in your neck. We're looking to restore that normal function. And by restoring the normal function through this pivotal area there, by making a precise and personalized correction, what we're looking to do is allow and reduce that pressure at the brainstem so that the normal brain-body communication can flow the way that it's supposed to. And when that happens, guess what? Your brain doesn't need to make the rest of these compensations the way that it had, and it means that your body has a much better opportunity to be able to untwist, to be able to unwind itself, and to go back toward what the default setting of your body is. That is 100% health. That doesn't mean that 100% of all health conditions are related to a misalignment in the upper part of your neck, and it's because health is a combination of how well you move, how well you exercise, how well you sleep, how well you eat, the thoughts that go on between your brain. But what I'm illustrating here is that one of those key and irreplaceable elements is that your body is working the way that it is designed from inside and out. And our particular emphasis is on the electrical system that gives life to every muscle, tissue, cell, and organ in your body. So let's go ahead then. We're going to have a look to see what the research is showing about the connection about what's happening with that C1, C2 as it relates to, again, the development of a scoliosis, or again, these lateral curves through the spine. All right, so this one here, this is a bit of research that came back from 2021. And what the researchers were looking for is they were assessing the craniocervical junction, so that's the top vertebra of the neck here, using radiological measurements in patients with adolescent idiopathic scoliosis and also what's known as Scheuermann's kyphosis. This is a condition that we more commonly see in guys, and there is a developmental component. And in fact, I should pause and mention right here that, of course, there are also anatomical considerations that we need to take into account. We inherit certain bony features when we are developing, whether we are still in the womb or even as we're growing up as children. There are certain changes in bone structure that do occur, and when those changes happen, we may never be able to fully undo that amount of damage. In other words, this is not a video saying that, oh, okay, all we have to do is adjust your upper neck and your whole spine is going to go straight. Absolutely not. What we're saying here is that when there is a problem in the upper neck, what that's going to do is that's going to have the potential to affect the function of your body. And so our goal here is so that your body can be working as well as it possibly can within limitations of matter. And that's the difference between a person who is experiencing pain and dysfunctions in their body versus, guess what? Those curvatures may still be there, but they're able to do all the things in life that they want without pain, without dysfunction, and without worry about things going downhill really, really fast. So the researchers here, they're looking and they're doing certain measurements of the upper part of the neck, and they're comparing this with 3 groups. So group 3 is a control group, people with no issues whatsoever. Group 2, these are people with that Scheuermann's kyphosis. It's a rounding through the shoulders, kind of stooping forward like this, but imagine a person is stuck in that position. And then group 1, this is referring to the scoliosis group. And so what they find that group 3, so the normal group, they had what's called a higher posterior atlantodental interval. And I'm going to explain what this all means in just a second. The ADI measurements in group 2 were significantly higher than the other 2 groups. That's important for the scoliosis groups. And group 3 had significantly higher basic and dental interval measurements than group 1 and group 2. So they are finding that there are actually measurable differences between the normal population and people who have these distortions of the spine. So let me go ahead and show you what these particular measurements actually are. Here is a big little zoom up, and I don't have all the anatomy quite illustrated here, but we would be looking from a side view. Here's where your jaw would be. Here is where the base of your skull would be. It's that giant bone that you feel just under and behind your ear. And then we're looking at the top vertebra in your neck, and then we're looking at the second vertebra in the neck. So, no particular order. The first one that we talked was the posterior atlantodental interval. What this is referring to is the overall space or the length of your neurocanal. So this is going to be where your brainstem and your spinal cord are actually transmitting up and down between brain to the rest of your body. What they're finding and what the researchers remark is that when that area is nice and open, these people have a tendency to have normal spinal curves. But as you see that one starts to decrease, then that is actually setting a person up for developing different kinds of distortions in their spinal structure. What they also find, particularly as it relates to the front part of the vertebra and as it relates to scoliosis, is that the atlantodental interval, so this is the forward space between the C1 and the C2 vertebra, it's only supposed to be about 3 millimeters in adults and 5 millimeters in kids, that as that increases or stretches too far forward, that seems to be one of those risk factors that's associated with scoliosis. And I think you can appreciate that if this area here gets wider, that's going to happen because that top vertebra is misaligning forward. And as it goes forward, there's not going to be as much space in the back. So the front part's going to get stretched and the back part is going to get narrowed, which means there ain't enough room for your spinal cord in that particular area. What did we already mention? We said, well, if there's going to be tension and irritation of the nerves and of the brainstem, your body's going to have to find ways to compensate for that. The last one that they talked about was what was called the Bayesian dental interval. So this is the space between the C2 vertebra and the base of your skull. Same thing. They're finding that if it's the appropriate amount of width, then spine seems to develop pretty normally. But as that would start to approximate, which would mean that things are starting to actually get shifted or distorted in different directions, this seems to be a factor that is setting a person up for the development of abnormal curves through the spine. Now, to be clear about something else here, this is what the research concludes. They conclude that the presence of scoliosis and Scheuermann's may affect the measurement of CCJ, so the craniocervical junction, and it may be considered to evaluate instability of the region. So, these researchers are not saying what the cause is here. They're saying that there is a correlation between these two measurements, and correlation does not necessarily mean causation. The researchers are looking at things from the perspective that when a person has distortion of the spine, what it's going to do is it's going to affect these particular measurements by causing stretchiness in the upper part of the neck. But I would argue, based on other research that's out there, that it's actually the exact opposite way. And there's no such thing as absolutes. Nevertheless, I would argue that the problem in the upper part of the neck, that is what's actually contributing to the development of these abnormal curves in the first place. And to support that, this was a study that was done back in 2021. I did a video about this one some time ago because this one here was a really, really big deal, and yet it did not make all the headlines. What the researchers were looking at in particular is they were looking at leg length inequality in people, kids specifically, who had been diagnosed with a certain form of idiopathic scoliosis. And what they found was that on the average, these children had a leg length, an apparent leg length inequality of around 11 millimeters. So that's going to be upwards of somewhere around half an inch. Now, the normal margin of error that we know from other bits of research is an eighth of an inch. So we are talking about 4 times the amount of imbalance going on in these persons' bodies. And if you ever want to be able to say it's a very simple kind of test, you have a person lie face down on the bed, try to go down in a straight line, and you look at the relative amount of imbalance between the two legs. Normal, I repeat, is within 3 millimeters or an eighth of an inch. And if you ever want to be able to measure the amount of tension that's in a person's body through their muscles, their ligaments, the joints, it's a very simple way to see if something like that is going on. So what they found was that there was 4 times the amount of tension in these kids' bodies who had been diagnosed with scoliosis. And so what they did was they said, okay, we want to see if there's a link with the upper part of the neck. And what they had them do was they had them go see an upper cervical specific chiropractor who did a series of diagnostic tests, did a series of images, and they found the exact direction degree of misalignment of either that top or that second vertebra in the neck. And what they did was they then followed them up over a 3-month period of time. And what they found was that on the average, with just a single correction, and in some cases there were, 2 and up to 3 corrections that were actually required, that imbalance reduced from 11 millimeters all the way down to 1. In other words, basically well within the normal limit. Now, they didn't do x-rays of these kids because that would have been, a whole bunch of extra ionizing radiation. It's very tricky to get research done along those lines. But let's think about this for a second here. Is if you make a little correction to the upper part of the neck and it changes the tension and the structure that's showing up in the foot, it means that that imbalance that you saw was never anatomical in the first place. It means that it was a functional, it was muscle tension because of issues going on with the neurology. And if you tap the neck and you change the foot, guess what? Everything else in between had an opportunity to be able to untwist on its own. And that's another important part from this particular study. The only adjustment, the only correction that was ever made, the only therapy was adjusting the upper part of the neck. And so what the research concluded here was that there is an association between leg length discrepancy and the upper part of the neck among scoliotic children, and it can be reversed by means of an upper neck realignment which can be sustained. What that means by can be sustained is it's not just a temporary treatment. It's something that can actually hold, heal, and stabilize. And we can appreciate this especially if kids have a lateral curve that's developing and it's accelerating toward, where there can be some really, really negative consequences there. It means that you have an opportunity to be able to actually change that process and start going to where the body literally is untwisting itself. So we go back here to that initial video that I showed you, and what we're proposing is the possibility that when you've got that physical injury that affects, again, not the stability per se, again, not broken bones, not dislocations, but it creates a shift in the upper part of the neck that curvatures of the spine, like this, create tension, but this is part of the body's compensation strategy. And so you can focus on all of the different sites where a person might be experiencing pain or discomfort. But if that is not where the primary issue is coming from, that is never going to fully resolve what that underlying issue is. Now, this is still a big if. Remember, this is a proposal, but this is something that we see experientially. We see this clinically all the time. And that is that if you are able then to make a correction to that upper neck, what happens is the body has that opportunity to be able to begin to unwind itself. Now, granted, if a person has reached skeletal maturity, so certainly 25 years old, but even, late teens, we may never be able to undo all of those changes that could be happening in a person's body in the same way that we can't undo time, gravity, and stress. But if we can allow the body to be able to untwist itself as much as possible, it means that you don't have that same amount of tension going on through a person's body. If there's not the same tension going through the body doesn't need to compensate in the same way. And it means that things can start working and you can actually start moving back toward your 100% level of health. And that means that there's a much decreased risk then of going on to develop so many of the different problems that can be associated with a structural scoliosis. So the take-home message here, again, is that if there's a problem in the upper part of your neck, it's going to have an impact on your muscles, your ligaments, your nerves. But if you can make a precise and personalized correction to that area, allowing that joint to be able to move the way that it's designed, that will help to take the tension out of your system, which means that your body has that opportunity to do what it is designed to do. That is heal itself. And when that happens, so much more is possible in terms of healing, well-being, and ultimately changing your life. So I hope that video explains a little bit of the process, how it is that the upper part of your neck can have an impact in terms of the overall structural alignment of your spine. And if you've enjoyed this video, we always ask you 4 things. Number 1, please do hit the like and subscribe button so that you get updates for all of the other videos that we do just like this one, talking about the big idea. Number 2 is if you have friends or family who you think would benefit from watching this, please do share it with them. Number 3 is if you want some more information, you can go to my personal website, which is drjeffreyhanna.com, which is where we've got all kinds of other articles and videos that talk about how, again, this little part of the neck affects your health, your well-being, and your body function in big ways that you may never think are actually associated with the neck. There's also a link there for email so you can get in touch with me personally. If you have any questions, if you have any requests for other videos, I'll be happy to do that. And if, of course, number 4, we've said something in this video and it's struck a chord with you and you're looking for care, you're ready to be able to take that next step, find out what we can do to help, you can visit us at our practice website, which is clearchirospokane.com, or you can give us a ring at 509-315-8166. We'll be happy to coordinate a consultation with you, do a few assessments, find out what's going on, and do the very best that we can to help you live the quality of life that you really desire. So thanks again for watching this video. I'm Dr. Jeffrey Hanna at Chiropractic Spokane. Get well, live well, stay well. So until next time, take care. Bye-bye.